This is KTN News.
My name is Dr. Edwin Boit. My background is in sports medicine and exercise physiology.
Sports medicine is a green field in Kenya, but in this rarely explored area is Dr. Edwin Boit, who has found a passion in not only working with athletes and sportsmen, but also with everyday people to rehabilitate them after surgery, injuries, or in even managing chronic illnesses like diabetes and hypertension.
With the current way in which the medical system is set up, the way in which patients are moved through the hospital has increased. So the hospital stay used to be a bit longer. Now it has reduced for, of course, financial reasons. There are different reasons. So what usually happens is that by the time a patient is discharged from the hospital, let's say they've done a shoulder surgery and gone through 10 sessions of physiotherapy at the hospital setting, these people are still not okay. And after that, they're still wondering, look, my arm used to move all the way up, and now it's moving until here, but I've been discharged from hospital. So what do I do? So that's where we come in. We now try and make sure that this person, if you are able to get your arm all the way up, we're able to do that. If you have still some pain, we try and manage that. So it's complementing whatever surgical procedures had been done with a sort of extended rehabilitation phase to make sure that the outcome is as effective. And I'm sure that many people who have undergone surgery and they're like, my life is not the same, we try to get them back.
After writing an essay to convince his parents on why sports medicine and not engineering was the right fit for him, Dr. Edwin Boit looks back proud of his accomplishments that make him one of very few Kenyan specialists in sports medicine.
Initially, I was supposed to set out to do engineering because, you know, sports has always been seen as a pastime. But actually, I had to write them an essay explaining to them what this sports thing it is that I want to study and how I would actually make money off of it. And actually, after I wrote them the essay, they told me, look, we believe in what you're doing, and actually encouraged me. And I was able to study this up to PhD level.
As if to prove a point, at only 28 years of age, Boit got his PhD, a Doctor of Philosophy in Sports Medicine.
We came in, people didn't understand what it was exactly we were doing. Tried going through unions, tried federations and sports. So with time, people are starting to see the value. So they know that athletes need to be treated a bit differently in terms of their injuries, but also I have a keen interest in sports performance, so I also run a sports academy for kids. So I'm looking at building sports from both performance and also looking at rehabilitating them when they get injured, so giving them longevity, because we see people like Cristiano playing until they're very old, and it's because they've taken care of their bodies. Us guys in Kenya, our athletes barely reach 28, so we want to see how we can help them grow beyond that.
His passion for sports medicine stemmed partly from his passion as a decorated athlete and partly from his own experience with a sporting injury, a swimmer's shoulder that resulted from his competitive swimming.
Growing up, I was always into sports since I was in class 1. I even represented the national team from 2007 to about 2012. The national swimming team went for all African games, won 2 bronze medals. I've gone for world championships. And the current state of affairs in sports sort of got me interested in the line of sports. Initially, my initial passion was, or still my passion was, sports performance. But I now also look at helping athletes who have had many injuries, because I have also had an injury that almost knocked me out from swimming. And many people didn't know how to handle it. So I really struggled with that also.
What injury was that?
It's called shoulder impingement. So a lot of swimmers, it's called even swimmer's shoulder, just to make it easier. So it's when this muscle at the top gets trapped under the bones and there's a bit of inflammation, so you can't swim anymore. So I had it for 3 months and it was excruciating. Yeah. So luckily in the university I went to, there were there was a few of the ex-students who had studied biokinetics or even sports medicine. So there was one lady who actually helped me rehabilitate it. She was actually a physio who had specialized in sports medicine. And initially, after going round and round, once I landed on her, she was able to sort out my issue in just a few months, and I was able to get back in the water when I thought I had to go for surgery.
From then on, there was no doubt in his mind that his goal was to help fellow athletes and sportsmen with injuries and grant them an opportunity to pursue their sporting careers for longer without retiring too early, prematurely.
Athletes only contribute even less than 1% of the population. So we see athletes from time to time. So we see athletes all the way from high school up to people who are playing in some of the leagues. However, majority of the people we see a general population, because that's most people don't play sports, but most people get injured, and most people are not taken care of well. Because I'm sure there are many people out there who have gone for physiotherapy, lower back pain. You go to the physio, they do a bit of massage, you come back, nothing happens. So we are looking at also making sure that injury rehabilitation is done properly, even for people who have just come recovery from surgery. If you have lower back pain, we look at addressing the underlying cause. So that's one thing us guys focus on. So when you walk in, we do a very comprehensive assessment. So if it's your lower back, we don't just start massaging the lower back, or we don't start giving you exercise for lower back. We start looking at, okay, what is causing it? Is there anterior pelvic tilt? Is there an anomaly? Is there a muscle imbalance? So what exactly is this that's exacerbating the back? Do you have a compression in the lumbar vertebra? Do you have issues with your nerves? And then once we find out what the issue is, we're able to treat it systematically, and we're able to attack the root cause of the problem. And that's why we have quite good outcomes with patients who have pain. And then slowly bring them back down. Okay, that's one. Up again. And for most of the cases, for you to get better from recovering from pain or an injury, you need to move, or you need to address muscle imbalances. So we take it a step further and use the exercise rehabilitation. We get the moving, we get to address some of those imbalances. If it's your knee, we are finding out, is it the front muscle or the quadriceps or the hamstrings? Is there an imbalance that's causing the bones to move incorrectly? So we address that, and we're able to focus and give them longevity. So once they leave here, we give them some home-based stuff that they do, and then the pain goes and never comes back again. So that's why I try to educate physiotherapists and tell them, look, exercise rehabilitation is part of the paradigm of rehab. This passive stuff of you just coming and massaging is not good enough. And I feel people are taking to it, and I'm happy. So this is helping you strengthen the muscles around your pelvis.
But from a sporting dream, Dr. Boit finds himself working with the general population.
So initially, I actually saw myself just working primarily in a professional sports setting, so working with teams. So I saw myself, okay, I'll be working with Kenya team, and I'll be helping them with their injuries and all these other factors. But of course, the way the sports is set up in Kenya, I found myself deviating more towards private. And I found a whole new space where they're just normal people who are not athletes who are in so much pain. So I still have my passion for athletes, but I'm finding like now I can help everyone, which is quite good.
His work mainly involves everyday people in need of rehabilitation following certain traumas, be it physical or emotional rehabilitation.
It's a multidisciplinary approach. So I work with, for that specific injury rehabilitation, we work with orthopedic doctors. So they're the ones who normally send, especially special cases to me. So people who have tried regular physiotherapy and they have not gotten good outcomes. So they sort of send the difficult cases to me, and also sports people, or people who even are just recreational athletes. Someone says, look, I enjoy running Karura on the weekends. I can't do it now because my knee is in pain. What can I do? Regular physiotherapy has not helped, so now they're sent to me to sort of see if we can help them. We normally want to monitor them 24/7 to find out whether the heart is beating normally. So we normally use this device. It's a portable ECG. It's very important to understand that the primary function of the heart is to pump blood to the body and to allow us to move. So for us to make it stronger, we need to move. So currently in Kenya, when people are recovering from heart attacks, heart conditions, they're normally just, there's not much that's done. But what we normally do, we have a program that helps people strengthen their heart, return them back to normal function, because people think that it's a death sentence after you've had a heart attack or been put for a stent or any other issues or cardiac issues. But we sort of try to help them rehabilitate in a safe environment, because if you were to just send them and tell them go and exercise, you don't know whether they would have a repeat event, or you don't know whether any issue has occurred. So we work with specific cardiologists from Aga Khan Hospital across the road, or any other, we're trying to get a few more, and we try and get that process going. We also do pulmonary rehab, so people who have had lung disease. Of course, now with COVID, you know, it really affects the lungs. So we look, again, exercise is primary or key in terms of rehabilitation, by strengthening, you know, the muscles that help us breathe, increasing the utilization of oxygen in the body. So we also run a pulmonary rehab. That one is still pretty new, and we're trying to get it off the ground, but we've had a few clients who have come through for that. Another one that's really affecting very many Kenyans is chronic diseases. We know many people with hypertension, many people with diabetes, many people with osteoarthritis. So especially stuff like diabetes and hypertension, these are diseases that are caused due to not moving or eating badly. So we look at getting people to exercise in a correct manner, because like people with high blood pressure, there's an exercise protocol we have come up with that helps them reduce the blood pressure, and combined with nutrition. So these are people who are possibly taking medications before, thought it was a death sentence, that they'll have to take medications for the rest of their lives. But now, through structured exercise, nutrition, and lifestyle, things as simple as sleep. I know we are focusing on, my background is in sports medicine, but we look at everything. If you get people sleeping better, their blood pressure improves. If you get people eating better, the diabetes disappears. Not for everyone, but for some people. So we also run chronic disease management. There's a place for surgery, there's a place for medication. So when conservative treatment, or treatment that is, so we start with conservative treatment. So some people still do need. So if your osteoarthritis is too severe and your cartilage is almost all worn out, you do need to go for surgery. Or if you have, some people get something called tennis elbow. So sometimes the inflammation is just too severe, or the damage is just too severe, so they need to go for that. Or the shoulder has too much, the bursa or the fluid gets too filled, they need to go for decompression. So that's the way it works. So it's a combination between medical or traditional medical and conservative treatments put together, and works in a very good manner.
Assisting people cope better with pregnancy, stress, and mood disorders is on Dr. Boit's to-do list.
I'm trying to convince a lot of psychiatrists and psychologists to buy in, is using exercise therapy for mood disorders, depression, or different mood disorders, because the current treatment for people with depression sometimes would be something like using SSRIs, or serotonin reuptake inhibitors, and exercise has actually been scientifically proven to be as effective as those medications.
There exists room for expectant women or those who have just delivered in learning ways to better manage the weight gain that comes from a pregnancy.
What usually happens is when they're expectant, they struggle with weight. They're scared of moving because they don't want to harm the baby. But we normally tell them, look, exercise is safe, even up to a few weeks before you deliver. You can actually exercise safely, so that even after you can continue being active. And also we also give them a nutritional plan so that they don't gain weight or become obese. Because I see many clients who come in and they have gained 50 kilos, 30 kilos, and they're telling me, look, doc, I don't know what to do. I was 60 kilos, now I'm 100, and it's not going away. I can't move, my back is in pain, my knees are in pain, my stomach is out, what can I do? So we also help, we have an antenatal and a postnatal program. But by this time, they've already done a stress test. With osteoarthritis, what usually happens is that, you get the two bones rubbing against each other. So what we normally do, so that's normally caused, there are different causes for that, but what we normally do, we try strengthen the muscles around the knee the knee joint. So that's the most common one we get, is knee osteoarthritis. So once we strengthen the muscles around the knee joint, they're no longer rubbing against each other. And for most people who come early enough, we're able to actually get them pain-free, completely pain-free. But for those who the condition has degenerated, we can at least help them move. We even had a client who had come in, has done 11 years of physiotherapy. She's about 70 years. She has knee osteoarthritis, quite advanced. She was working with a cane, done 11 years of physio, nothing had helped. So she came to us. We were able to strengthen the muscles around the knee joint. She's walking. She does not use her cane anymore, and we've given her life back. So for people who have osteoarthritis, we're also trying to, and it's about movement. Some of them get them due to not moving over a long period of time, and now there's too much pressure, and now we get them moving in the right way. Then what I'll need you to do is when you raise your right arm, you also raise your left arm. Okay, let's go. 1. Down. This exercise helps the pelvis tilt back.
There's a long way to go, he says, for sportsmen and women in the country, but he hasn't given up. He spends his time grooming the next generation of athletes, young boys and girls from the age of 4 to teenagers, on how to best take care of their bodies while enjoying the sporting activities they like most.
It's sad to say in the high school or even primary setting, a lot of the people coaching these athletes are not well trained. They're not educated on some of the considerations with teenagers, you know, when they go through the growth spurts, and the bones or the epiphyseal plates are not yet fully fused, and they're going through the growth. There are specific conditions that they're predisposed to, and some of the coaches are not actually, it's not their fault, but they're not educated on this. And some of the kids themselves don't know. So they normally come here, especially with a lot of knee problems. So it's about also getting some of these education programs running in the schools for sports, because teenagers are they have a huge predisposition for injuries when they're going through puberty. So you'll squat until there, hold it for 2 seconds, and go all the way up slowly. 1 more. We need people who are specialized in field of exercise physiology or sports medicine to help them manage them. Secondly, athletes are getting too many injuries. So I know so many athletes who come and tell me, look, I've tried everything, I feel like quitting my sport. So there's a place for specialized practitioners who can work with athletes, rehabilitate from injuries, and continue being, you know, athletes are people first. So even making sure that they're healthy. So there's a huge field working with both athletes and working with the general population, sort of help the national burden for chronic disease, and also help athletes train until, or exercise and compete until they're 40 years, which is possible.
Dr. Masi Korir for Doctor's Diary, KT News.
This is KTN News.